Hello, and welcome to the learning series titled Learning Together, Emergency Shelters and Substance Use Centers. Please note that this session is being recorded. We are pleased to offer French simultaneous interpretation for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your Zoom screen. If you need support at any time during this webinar, you can reach out to one of our producers using the chat feature. My name is Jessica Hodge, and as program lead on this program, I am so excited to be joining you as one of your co-hosts for today's webinar. I would like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, I acknowledge that I am hosting this webinar from Perth, Ontario, which is the traditional territory of the Anishinaabe, Huron-Wendat, and Haudenosaunee St. Lawrence Iroquois peoples. This territory is covered by the Upper Canada Treaties. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. At Healthcare Excellence Canada, we continue on our learning journey and commitment to support improvement with and for all people in Canada. Healthcare Excellence Canada is an organization with a relentless focus on improving healthcare with and for everyone in Canada. We believe in the power of people and evidence and know that by connecting them, we can achieve the best healthcare in the world. HEC is an independent not-for-profit charity funded primarily by Health Canada. We are pleased to share that this program is delivered in partnership with the Canadian Centre on Substance Use and Addiction and the BC Patient Safety and Quality Council. Thank you for taking the time to join us today for this important discussion. We are grateful that you were able to take some time to participate and hope that hearing from our speaker supports you in your work. Before we get to today's discussion, I want to first have our co-host introduce herself. I will pass it over to you, Sue, for an introduction and for you to introduce the speakers for today's webinar.
Hello, everyone. I'm Sue Craig, and I'm a knowledge broker at CCSA. I want to begin by stating that we at CCSA respectfully acknowledge that the CCSA offices are located on the traditional unceded territory of the Algonquin Anishinaabe people. The Anishinaabe Algonquin Nation has been present on and nurturer of this land since time immemorial. We are grateful to have the opportunity to be present on this territory. We acknowledge the Indigenous peoples as traditional knowledge keepers and that our greater society benefits from the sharing of Indigenous peoples. Today, each of the regions from which we gather are home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to be present on these lands. We strive for respectful partnerships with all Indigenous peoples as we search for collective healing and true reconciliation. I want to thank all of you for joining us today, and we look forward to a great presentation that will support you in your work. Now I'd like to introduce our presenters. Randall and Ellery is a passionate leader in ending homelessness with over 10 years experience building movements, shifting systems, and engaging community. Randallin is a skilled data and policy analyst with a passion for using continuous improvement and data-driven decision-making to tackle complex problems. Randallin joined the CAEH in 2018. In her role as the Director of Data Impact and Policy, she is focused on developing data and maintaining data maintaining data infrastructure and visualizations, measuring impact, and connecting data to policy development. Randallin holds a Master in Arts and Sociology and International Development from the University of Guelph and is based in Guelph, Ontario. Lee Denis is a full professor in health and policy management at the University of Montreal School of Public Health and researcher on innovation and health system at the CRCHUM. His research program is located at the intersection of applied health sciences, applied health services research, organizational studies, and policy research. His research aims at developing a comparative and transdisciplinary perspective on large-scale reforms, transformations, and improvement in health systems. Randall, thanks for joining us today. I'll turn it over to you to get us started.
All right, excellent. Thanks so much. Hi, everyone. My name is Randall, and I use she, her pronouns, and I'm joining you today from Guelph, Ontario, which is the traditional territory of the Mississaugas of the Credit. And I've been asked to share with you today the impact of the COVID-19 pandemic on housing and homelessness. And so I am looking forward to digging into some of that with you. If we can just go to our next slide. So how I'm going to shape today's presentation is to talk to you about the impact on the sector, on the housing and homelessness sector throughout the different waves of the pandemic. And the way that we have this information is that we had been, as the Canadian Alliance to End Homelessness, have been surveying communities in the sector since the pandemic first started back in March 2020, and have done so regularly throughout the different waves. And so I'm going to touch on some of the key challenges and opportunities that arose during each of these waves, starting in the pre-pandemic when we were doing okay as a sector, really driving reductions. And then we'll move into the first wave and like many folks caught quite off guard and kind of grappling with some of the initial challenges. And then we'll move through our second, third, and fourth wave. So if we flip to the next slide, we'll kind of look at how things looked pre-pandemic. And we were, as a sector, on a very positive path. We had just seen the unveiling of the National Housing Strategy in November 2017, lots of excitement about that. We have heard federal commitments to end chronic homelessness. We've seen the expansion of the Reaching Home program, which is the main funding source for many communities to grapple with the issue at a local level. Provincially here in Ontario, we saw commitments to renew community housing and support housing strategies. We had communities across Canada that we were working with at the Alliance that were really demonstrating measurable reductions, which was inspiring the embracing of by name lists and coordinated access. So two approaches that have proven to be really valuable as communities focus on system improvement and reducing chronic and veteran homelessness. That being said, all of those good things happening, we still had many challenges. Communities that we work with, we're talking about increasingly complex clients that we're dealing with, increasingly trimorbidity of substance use, mental health issues, physical health issues, that we're kind of putting them in that category that we sometimes call hard to house. We also saw the rise of the opioid crisis, a lack of housing supply as our housing crisis in Canada reaches new peaks. The housing and homelessness sector having strained partnerships with the health sector in some communities about the approaches to take and how information can be shared so that they could work collaboratively together. And then we have a staff in the sector as well that are plagued by low wages, making it difficult to retain good staff, and as well dealing with burnout, trauma, PTSD. And this increased pressure, so all of these federal and provincial commitments, great news, but doesn't always come with the necessary resources. And so definitely a pressure to reduce homelessness, but not necessarily the supports to help communities do that. So that's kind of where we were at before the pandemic hit. And if we go to the next slide, we'll start looking at some of the data we collected very early on in the pandemic, in the first wave. So as you know, everyone was, we were quite taken aback at the pandemic and how quickly it occurred. And so we started checking in with our communities across Canada in early March. And the biggest challenge at that point was the lack of PPE. And so we were competing with the health sector and just about everyone who is trying to get their hands on appropriate PPE. The other challenge with the sector is an unfamiliarity with PPE to some extent, of not knowing the proper ways to don off the gear, and not knowing what was needed, and struggling to get the support from health partners who were, of course, kind of focusing their attention other places. So the lack of PPE was Definitely a challenge in the early days. The other thing was around staffing. So staff who are low wages, very concerned about the conditions they were being asked to work in. And some of them finding it perhaps a better option to take the Canadian Economic Recovery benefit and stay home, or maybe being required to stay home to take care of loved ones as well. And so staffing was also a significant issue. In terms of planning, we as a sector were unprepared. In early March, only 22% had a plan for how they would deal with the pandemic in emergency shelters, and even less when it came to encampments. And so the sector was really struggling to connect with and receive supports, and particularly from local health authority who, makes sense that we would look to them for support, but also makes sense that they were quite busy with other issues as well. So that's kind of how things looked very early in the first wave. And if we go to the next slide, we're still in the first wave, but you can see how quickly the sector responded to the issues. And so just about a month later, when we did another check-in with communities, we found that they had basically shifted their entire model into something new, and with no new resources and very little support from other partners in the community. And this model shift was primarily moving folks out of an emergency shelter where physical distancing wasn't possible and moving them into what we called isolation shelters, which for the most part was motels and hotels where folks could have an individual space. Other places were used as well, schools, different community spaces, but motels were the most often used. Communities still struggling with a lack of PPE, struggling to keep staff and to be able to make them feel safe in the context of the pandemic. And then also the challenges of moving this model had with harm reduction approaches, where perhaps in the emergency shelter, they may have had a better handle or better ability to provide harm reduction approaches. And it became complex when communities are now in a motel system and have limited movement in the community. We also saw the supports from health partners begin to shift and become more involved. So you can see on the top right-hand chart there, in terms of supports from local health authority, where we started getting more advice, more planning support, more integrated teams working together in those isolation shelters. But still, a significant challenge was with staff and volunteers keeping them in the emergency shelters. And so this was kind of a snapshot of what we saw in the first wave. And then if we go to the next one, we'll see the second wave. And so quite loosely, this was sort of the summer months, beginning in July 2020 on our left-hand side there. Even though the sector itself had shifted the model so quickly, there were a lot of concerns about the sustainability of this model, particularly because of the extra funding it required. So at that time, communities were saying, we can do this for maybe another 1 or 2, maybe 3 months, but we're really struggling to think about how we're going to maintain this model beyond that period. And so that was kind of the primary concern in July. Then in August, we started hearing a lot about the rise in encampments or people who are sleeping unsheltered. And this is a really difficult one to know. It's based on people's perceptions. And so perhaps it was an increase in the visibility of people sleeping unsheltered as kind of the general population pulled out and were quite staying at home. And so the visibility just became more obvious. We also heard from lots of folks who were not interested in staying in the shelter because they were concerned about their health and safety in the context of the pandemic, and so were choosing to sleep unsheltered. But we did have about 50% of our communities saying that there was an increase in that population. in September, we really saw concerns peak about the collision between the pandemic and the opioid crisis. Communities were reporting that there was an increase in problematic substance use during the pandemic, and we're struggling with the complexity of the clients. And then as we got into October, communities were really starting to brace for what was going to come in the winter months. So trying to develop their typical winter shelter plans, but also dealing with it in the context of the pandemic. And so at this time, we're also seeing rise in harmful drug use, limited access to supports and services, and staff burnout. And then if we move into the third wave, which is on our next slide, this is kind of end of December, early January. And so what had been really interesting up to this point is that the number of outbreaks in emergency shelters had actually been quite low. So they were definitely happening in our larger cities, Toronto, Ottawa, Edmonton, we were hearing, but they really didn't hit mid-size or smaller communities until early 2021. So we started to see a spike. So in that red area graph, you can see that numbers of outbreaks that were being reported kind of mid-January spiked up at that point. And so this is kind of during the time when we started thinking about maybe things are getting back to normal. But in fact, some of our communities, mid-size and smaller communities, were being hit the hardest at this point. We knew about outbreaks in emergency shelters. We're also hearing about lots of outbreaks in housing situations, either social housing, transitional housing, but less so in encampments. And whether that was about the disconnect in the outreach services and that was happening in encampments. But we just didn't hear as much about outbreaks in that kind of situation. The bottom right-hand corner, you can see there that 73% of participants experienced at least one outbreak in an emergency shelter since the start of the pandemic. So this is early 2021, 3/4 of that population experiencing outbreaks. And 32% report that all outbreaks happened since the start of 2021. So a significant portion of those in those first few weeks of January. All right, and then if we move to our fourth wave on the next slide, this is when we start thinking about the new normal, right? So we're hearing of vaccines, and it feels like we might be able to return to something or feel some kind of normalcy take place. We did ask communities at this point to kind of reflect on what those initial challenges were, what current challenges they were experiencing, and what the anticipated challenges were. So we talked about kind of initial challenges being lack of PPE, lack of funding, challenges with securing location for isolation. And then it became about how do we maintain that. Anticipated challenges are about maintaining that location. So there were lots of motels, hotels, community spaces that opened up initially, but in the past few months, we've been hearing of communities that have had to shift and find other spaces as those go back to their original use. Funding continues to be a challenge. We did experience injection of funding from the federal and provincial government during the pandemic, but it has kind of returned to normal funding models and haven't heard of anything additional at this point. Still struggling with staff resources and maintaining a staff. Staff also really struggling during the third and fourth wave with the burnout that has been brought on by the pandemic, the constantly changing the model and how they provide supports. Based on the information available to them, survey participants were also asked to talk about increases in homelessness or changes in homelessness. So some communities have better data than others. And so some of this is data informed, some of this is their perception of what's happening in the community. But we asked about all homeless or chronic homeless, and overwhelmingly an increase in both of those populations, in both chronic and all homeless. We also asked about, have you seen increases in the number of folks staying at your emergency shelter or in encampments? And again, in both cases, seeing increases across the board. 75% of communities reported that unsheltered homelessness has increased. 55% saying hidden homelessness has increased, and hidden homelessness is typically a couch surfing environment. And then also an increase, 85% saying an increase in those at risk. And the expectation is that we will just continue to see the numbers rise. The numbers that we monitor and feel good about in terms of quality data tend to be on the chronic population. And so in that scenario, folks would need to be experiencing homelessness for at least 6 months. And so we have started seeing the inflow into chronic homelessness increase as those who have, lost their housing in the past year or so are meeting that definition. And then we also asked about concerns moving forward. So 45% report that staff or guests in the shelter have come into contact with COVID in the emergency shelter system in the past 3 months. And when we were asking about the number of cases in our regular surveys, we were seeing a really interesting pattern where we would see the number of staff cases spike 1 week, and then 2 weeks later, we'd see the number of cases spike among clients, and just kind of ping pong back and forth for months at a time. There have been, as I mentioned, outbreaks in the emergency shelter system that continue to hit those smaller and mid-sized communities, and as well starting to see or become more aware of the outbreaks in encampments as well. The other piece that I don't know that I covered on the slides here, of course, but was during the fourth wave and third wave, is around vaccines and distributing those to clients or to individuals experiencing homelessness. And the challenges being tracking individuals between doses being probably the #1 challenge. The other one is vaccine hesitancy, of course, and misinformation that is out there. And so we've started to hear lots of, it becomes more and more challenging to get shelter guests to abide by the pandemic rules, despite perhaps a lack of vaccination, and it's still being very important to distance in those environments. So I think that wraps it up for me. Happy to share that information with you, but also super happy to answer questions and engage in a discussion when we're done here. Thanks.
Great. And thank you, Randolyn, for your presentation and sharing with us the data that you've collected over the last almost 2 years, and sharing the current and anticipated challenges of the pandemic for those serving the homeless population. I'll now hand it over to Lee Denis, who's going to do a presentation on managing change in turbulent times. So Lee, over to you. Oh, Lee, I invite you to unmute yourself as well. Thank you.
Yes. Thanks for the invitation, and I guess it's better when the micro is open, or at least I hope so. So I was very impressed about the presentation, the data, and what is revealing in these data about the experience of the pandemic for your organization. And I've been asked to speak about change. And one of the basic rules when we talk about change is having a lot of information about context, specific challenge and problems. And I guess you share similar issues across Canada in your sector, but I guess with local specificities. So on my side, I decide to be more generic, to raise some ideas about change when we face a challenging time like the pandemic. And one thing that appear very clear for me is that in every sector, the pandemic is a revelator of capacities for change and adaptation. And your sector clearly showed this. At the same time, it revealed persisting vulnerabilities. And in the so-called recovery phase after the pandemic, there are adjustment and adaptation to make, and your data show this clearly. What will happen when resources will become lower as before, when we will not benefit of specific program and so on. So that was the introduction. Next slide. I found your strategy à la fois challenging vision, but I guess an achievable one. It won't be totally zero, but I know, again, your data show this, you make significant progress through time. And I must say that I admire this. I have a daughter she's a social worker, and I'm living downtown Montreal in a very hotspot area. So I don't have direct experience with the situation and the person you work for and the problem you deal with, but I have some day-to-day knowledge, let's put that way. So next slide, please. So a kind of general learning about change is that organization or sectors achieve major change and adaptation with others. And defining these others may vary across different sector of activities, but this idea that more and more we bring significant change, including significant policy change, by joining network. It may be network of organization like a Canadian Alliance, or network of actors that can help doing things differently, including co-opting resources, expertise. So next slide. And this is small, but I guess I have it in my mind. Here, when you look at change, we think about change as around 4 pillars. One important aspect for change are ideas or mindset. And sometimes it may be very simple things like not providing shelter just because it's winter, but shifting the mindset and saying we need permanent home for homeless people. So that's a kind of change in mindset, and it has a lot of consequences in the way we will think about action, strategy, and how we will work with others to achieve this kind of objective. Another aspect is really structure, but what I mean here is the structure of a sector, our resources flow, where it's come from, how we can get organized considering this structural limitation or opportunities in a domain or a sector, and I will come back to this in the end. Then change is learning at the same time, and we learn to do differently by having occasion for experimentation. And I don't mean by this pilot project, it has not a very good reputation in Canada now, pilot project, but what I mean is the opportunity to try to work differently and to find different solution to persisting problem. And again, I will come back to this. And the other aspect, which is very important, is the relational aspect to change. When we try to do things differently, we will need probably, at least in my experience, you need to connect with new actors, new organization, like I underlined before. And it means that you need to develop trust between these new players and with these new players. And when we think about change, we see change as effortful because it's implied that we depart from the usual way that we do things. So change is effortful, or it's a kind of work for people engaging in change process. So next slide. So, and today it's really an exploration, like in 15 minutes of some ideas around change. So what I decide to do is sort of talking very briefly about the mindset part and 3 mindsets to explore opportunities and challenge for, let's say, for change and adaptation. So next slide, please. So the first mindset is labeled positive organizational scholarship as a resources for change. Next. And this mindset, and it strikes me when I look at, let's call it community-based organization, they are in their ADN like mission-driven organization. You may say that every organization is mission-driven, but some organizations are much more driven by their value, by a mission that they feel is so important for other human beings that people engage in working in these organizations because they are driven by making a difference for other fellow human beings. And in these organizations, and this is a very important asset for change, we often look at what we call positive deviants, like people that achieve amazing things with very little resources and, I would say, unusual commitment. And this is a very important asset, but at the same time, and your data show this, it can be very exhausting because individual people or collectively within, let's call it a community-based organization, try as much as they can because they are so driven by this mission. They try as much as they can to compensate all deficiency or limit at system level. The most easy example is the level of resources that they have access to serve their client in quotation compared to other sectors of activity. So that's a very important resources for change and adaptation, but at the same time, it's a very risky situation because people can get exhausted. So they need to rely on other mindset for change to survive, if I put it a bit dramatically. So next slide, please. So from a positive organizational scholarship perspective, there is this idea that the machine of change is really based on unselfishness, altruism, like you have this fantastic, highly committed individual, and they will manage and achieve adaptation. We can help them under this mindset by trying to provide, not provide, but to develop some tools or methodology to work. Training is an important part of this mindset for change. And really here, the energy to get committed to bring about change and adaptation, it's because it's the attractivity of achieving the good. Let's put it that way. Next slide, please. And we can move the next one too, please. And another mindset for change is the social learning perspective. I guess most of you heard in different contexts the notion of community of practice. The idea here is getting systematic as an organization or a group about what we need to learn, say, to face the so-called recovery phase. And here learning is considered the key resources to increase the ability to adapt or bring about change in challenging contexts. It is based on the assumption that change is really emerging, like you get in the flow of events like a pandemic. You do daily adaptation as much as you can, and suddenly you feel, okay, we need to be more systematic around priority A and B, or around this type of intervention in the community, and we will design a machine to learn. We will identify some area, we will exchange experience, we may invite people from other organizations to share their experience, but the idea here is becoming very systematic about what you feel you need to learn, for example, to face the recovery phase. Next slide, please. And the machine of change and adaptation here is first what we call a discipline of domain. People collectively identify learning priorities for, say, for the next 6 months, we will tackle this or this problem or innovation to face this issue and so on. There is a discipline of practice, so people will collectively design a strategy for learning. They may say, we will share some paper on this issue and discuss if we have time to discuss it. We will connect with like HEC to organize webinar and so on. And there is a discipline of community here, like this machine of change will bring some positive outcome if people participate in a disciplined way in the so-called program of learning activities. And some people in the organization has to take the leadership for this. Like they will lead what we may call for today a community of practice. And it's different than the first mindset because you emphasize the need to develop new capacity and new learning in a very systematic way to build on the intrinsic motivation that is highly valued in mindset 1. So next slide, please. And next one, please. And then the third mindset for change, accept to discuss, and you often discuss this in this kind of alliance, is saying, okay, it's very good to be highly committed locally and work hard or nationally. It's very nice to have learning activities like webinar, but we need more. We need to think about change and adaptation at a more systemic level. And as clearly you show in your data, the experience in our sector are affected by broad policy. It may be policy like generated during the pandemic, but also what produce homelessness, what generate the kind of issue around homelessness, substance dependence, mental health issue, and can we find a way to change the equilibrium in the system? Like a lot of resources are devoted to the so-called classic and care system. Can we think about reallocating resources more around these emerging priorities? And can we get new policy that will better support us, including people working in our sector? So next slide, please. So here we move from looking at change a lot as an individual resources and for highly committed individual, to a mindset that say, let's get organized to learn new things together, to a third mindset that say, I guess it's through advocacy to political action, can we convince more people to be part of our coalition, our alliance, and then shifting the allocation of resources and power circuits that will help us becoming a more solid and sustainable sector? So next slide, please. So the machine of change here is really, can we activate more countervailing power that will send strong signal that we need more support? And this is not just resources, it's just being value as a sector that needs support and more people that support it. And of course, there are an element here of, I will use social conflict or political conflict, that at some time change is political, and it means that challenging an unresponsive social structure. It may be to prevent some major social issue, or it may be to offer more for people in very difficult situations. And as you know better than me, social change don't happen just because, don't happen naturally, usually. You need to shake structure in some way. And this machine of change really relies on this idea that what's happened very locally is partly determined by what's happened at a systemic level. Next slide, please. So what I have tried to do is just sharing different mindset for change without knowing how you identify or not with these different mindsets. My proposition is that developing strategy for change and adaptation need to combine the three, and their weighting will vary across context, period, like the recovery time after the pandemic, between maybe province, between jurisdiction, and so on. And I just put here some question that may be worth to discuss about, is it meaningful for you? Do you think you can rely on some of these mindsets to support your thinking and action around change, and how you can mobilize different resources for change in your context? I stop there. Thank you.
Thank you, Jean-Louis. I'll hand it over to Randall. Do you have any reflections based off of the presentation that Jean-Louis just provided and the context that you shared with us earlier?
Yeah, thank you. I think the mindset work is so important, and getting folks to shift from like the mindset of scarcity to one of abundance is perhaps one of the more challenging when we are adapting on the daily and scrapping for funding to keep moving forward. And I find it particularly challenging with frontline staff who are sometimes less connected to the kind of improvement work that is happening, or system transformation work that is happening. And so building those bridges is also such a critical piece of this. But the other piece that really spoke to me is about expanding and bringing others into your network, because we definitely saw the impact of that in the pandemic, of being able to pull this kind of data together to inform our government partners, which resulted in more funding. And so the more we can work together to identify these common themes and common threads that are happening across Canada and across the sector, the more power we have as an advocacy body as well. And so yeah, it has certainly proved effective for us to expand those that we're working with.
Thank you.
Great. Thank you. Thank you both for your presentation. We will now open it up to questions from the audience. So if you have a question or comment, please feel free to share them in the chat box. For those who would feel more comfortable to reaching out to a member of our team regarding your comment or question, please feel free to reach out to me directly in either official language, and I'll make sure that your question is posed to the panelists. So we'll start with one question. I'll share a question, then we'll go to my co-host Sue, who will also ask a question after. Randall, you spoke about the impact and issues related to the pandemic changing as the pandemic progressed, and how this also changed in large versus medium to small sized cities. What improvements come to mind for you that can be made to more rapidly respond to the needs of the sector, especially when there might be different issues facing different organizations?
Oh gosh, good question. Yes, we've definitely seen differences in the challenges communities are facing based on their size primarily. And so what happens is the larger communities do tend to be the ones who are better funded, and particularly by one of the advantages of reaching home funding, which comes from the federal government, is the flexibility and the ability for the community to determine how it's spent. And so, we have mid-sized communities that are also the recipients of reaching home, but that's been a critical piece to be able to expand funding that local communities have control over, and can use it to be very responsive to the needs that are happening. But it's also, another kind of mindset too is shifting away from emergency response to a housing focused response. So initially in the pandemic, particularly first and second wave, a lot of funding went to moving folks into isolation shelters, to purchasing PPE, to supplementing staff wages in emergency shelters. And as time has gone on, the communities that have been successful in either maintaining or reducing their active homeless numbers have become very housing focused. So rather than how can we fund kind of the ongoing needs, emergency needs, what are the opportunities to move people into housing and help them maintain that housing? So, I mean, the opportunity is there for that mindset shift, but it, of course, is super challenging to do when you're kind of in the thick of it. But across different size communities, that's the one piece where we've seen a common improvement opportunity.
So building on that, that constantly having to put out fires, the day-to-day sort of struggles, how then can we encourage networking and stimulate that change and sharing those best practices when people are in that sort of emergency mindset and that just focused on putting out everyday fires? Maybe we'll start with you, Randolyn, and then ask Denisha.
Sure, yeah. Connecting peers and facilitating peer exchange has been incredibly helpful, particularly when we're connecting communities of similar sizes or geography that they can learn from one another. That's been a pretty incredible tool, and also just kind of nice to hear like, oh, you're dealing with that too. We're not alone in this situation. That reassurance has been really important. Oh, sorry. And then I've lost my second thought, of course. Can you repeat it for me? Can you repeat
just the how do we just encourage people to do that networking when they're just so embedded in just their day-to-day emergencies? And then if you need a break to think about that, we can ask Jean-Louis.
Yeah, no, peer exchange would definitely be important. I know that, the virtual environment is becoming a challenge. People are kind of burnt out on that as well, and really anxious to get back to in-person connections. And then, but I mean, we have to work with what we can. So yeah, webinars, communities of practice, those have been really important. And then the other piece in terms of like encouraging improvements is just really trying to get communities to scale down. It becomes so overwhelming to think about how do we house people in the midst of a housing crisis, and it feels impossible. And so encouraging them to scale down, test improvements, and engage frontline staff in that experience as well has been really critical too.
And maybe just to follow up on this, like, in any organization, you have leaders. It may be formal and informal, but to move from a predominant emergency move to something else, I don't know exactly how to label it. It's an organization, despite pressure, need to have space and to pause sometime, and it need to be organized. This is the main take-home message of the second mindset. You need to find a way to pause, and this will generate new response, new ways of doing things, and it may help to alleviate pressure. I know it's not a magic stick, but it may help to alleviate some pressure if people have time to exchange experiential or other form of knowledge. And in my view, this is a key leadership responsibility.
So
to
perhaps
start the machine.
Sorry, I see perhaps that's something management can encourage, and perhaps, within organizations, those huddles that we've heard so much about are an opportunity to start internally and then, to go externally and take the information from those huddles.
I think the really important role that leadership can play in that as well is, we hear a lot from frontline staff about like, I can't possibly take something more on. And so communicating the message that this isn't more, it's just a different way of working. And I totally agree. Like, the leadership has a responsibility to create space and create opportunity for frontline staff to think through opportunities, identify what they think are solutions, test those solutions, and it's a different way of working. It's not a more.
And I don't know if there is another question or if I can.
Go ahead and build on that, Genevieve.
Okay, so and one of the aspects when we think about change also is to, and it's related to the scale down process that you referred to earlier, is that at some point locally people cannot do everything. Like they cannot infinitely compensate, for example, lack of resources, lack of decent working conditions, housing crisis. And I think we need to recognize this explicitly too, and then as you do as an alliance, to try to see, can we move up to other contexts to find support? Maybe I present the third mindset of change too much as a social political movement, but it's part of it. At some point, people need to feel that some support from the system are there to support what they do locally, because people get exhausted by trying and to compensate too much vulnerabilities in the system.
Great, thank you. We did have one question come through. So I guess, Randalyn, with your conversations with organizations across the country, have you heard whether a trauma-informed practice lens has been made available to support staff in those organizations?
Yes, I mean, I would say it's fairly common to use that approach and provide training as well with frontline staff. I think one of the challenges is just the rate of turnover in the sector as well. And so even an organization that's kind of providing training every 6 months, you do have quite a few staff coming in and out the door during that time period. We also saw communities do some interesting things to help support their staff. One community I know is able to partner with a larger organization to get their staff on an employee assistance program to give them more access to supports. Some communities were able to provide more flexibility in terms of their work arrangements. So I mean, I think that folks are doing their best to support the sector. But the reality of low wages and kind of unpredictable hours, and then working in an environment with increasingly complex clients is putting them in a challenging situation. I mean, and plus we're in a pandemic, and who knows what's going on at home. And I think, everyone's struggling with sort of the outcomes of that.
And I think just briefly, there is, in my view, an issue that you know better than me in this sector is the resiliency of the sector. How you can stabilize capacities. And so I think that's one of the major issues, and the pandemic, not just in your sector, is very revealing about how resilience vary across sector, and it's very difficult when you have high turnover.
Recently, we held our Canadian Alliance to End Homelessness conference, and we did a pandemic hero video submission. And I'll try and track the link down and put it in the chat, but some pretty incredible submissions of folks that have gone just kind of above and beyond throughout the pandemic. Yeah, really beautiful and inspiring stories too.
That's great, Randall, thank you. If you actually do find the link and you can share it with us even after the webinar, we will make that available to folks afterwards. And we're just going to wrap up now because we have about a minute left. So thank you to both Jean-Louis and Randall for your presentations today. Our next and last scheduled webinar will happen on December 14th from 12 p.m. to 1 p.m. Eastern Time. This webinar will build upon today's discussion and will be joined by Dr. Laura Lennox, who will introduce the concept of sustainability and discuss strategies for sustaining gains made during the COVID-19 pandemic. So a special thank you again to Randall and Jean-Louis for today's discussion. Please be sure to take a few moments to fill out the survey that's now on your screen. So I will read the questions
So
out.
I understand that we exit now.
Thank you, Jean-Louis. So the questions on the screen are, I know more about anticipated challenges of COVID-19 and strategies for change than I did prior to this webinar, from strongly agree to strongly disagree. Overall, I was very satisfied with my webinar experience, again, from strongly agree to strongly disagree. And I will be able to apply what I learned from this webinar in my work, from strongly agree to strongly disagree. So thank you all for attending today, and we hope to see you at our next webinar on the 14th of December. Have a great day, everyone.